Hi, my name is Diego Velasquez, and today I'm going to speak about the homework navigating between borders. Well, in this activity, I have to propose and analyze the differences between the health system in the United States and Mexico. First, my ideas or my proposals to improve health in general in both countries will be, well, educating people to know what types of diseases, what types of preventions, or even to where they can go to to have an appointment with a doctor so they can know if they are healthy, if they have diabetes, cancer, or any disease that's not easy to um, to notice. Like with my eyes, I cannot notice if you have cancer or diabetes, but with some studies and of course with the right people, you can know if you have a problem in your body, and you can treat it as soon as possible, so you can expect more years of life, a healthy life. Another way it's eating, like in our virtual meeting today with the Texas Tech and the UACJ doctors or students. They all of them agreed that one of the ways to improve health in your own house is just eating more vegetables, eating better food, not a lot of processed food like McDonald's, Carl's Jr., fast food, or in general, trying to eat in your house, a balanced diet, and of course, drinking as much water as possible, electrolytes, salt, doing exercise, uh, have a routine of things that you have to do. Of course, that's a very important thing. I think that's the easiest part. Of course, there's some diseases that they're not easy to treat just eating or just doing exercise. There's some diseases that you have to, of course, that you have to go to a doctor, have treatments, medicines, whatever that you need to be better of that disease. Of course, that's uh, that's a very important thing. Also, I have to make like a comparison. Well, I don't know if I'd say it right. I have to compare both health systems. Well, I think that the U.S. health system, it's really good. From what I hear and what I saw, it's really good. Doctors prepare themselves for years just to be able to attend to have a patient, to have an appointment with someone that's sick. I think that's really good. That's something that I got really impressed with. In Mexico, I think it's really good also, but it's less time. You don't need as much as preparation as you need in the U.S. I don't think that's a wrong idea or a wrong view of the studies that you need, because all my life I have been treated here in Mexico, and I really didn't. I haven't had any problems. I have gone to IMSS. I have gone to private hospitals. A lot of things that I really haven't have a real problem. Neither in private or public hospitals. I haven't have any issues. Also, I don't find really good that in the United States it's really expensive to be a doctor. Just to have the career, you have to, in just 1 year, 1 semester of medical career, they told us that it's about $150,000, and I think that's insane. It's an insane amount of money, and I think that if you really want to be a doctor, that's a vocation. That's not only because it's good money. Yeah, you have a really good pay and you are respected and all of that, but it's day and night of study, a lot of money. Um, it's I think that's, well, impressive. That's real dedication and not other things. It's just dedication, and that's vocational. In Mexico, of course, there's private schools, but public schools in Mexico are really good. Or UACJ, Watch, Tec de Monterrey, they are really good. And from what I hear and what I see and everything, there's no really one that's better than another one. Of course, both of them have their differences. Being Mexico, in public hospitals, they have a lot of patients, and it's really hard to deal with 100 patients a day. And in a private hospital, they have about 25 or 40 patients a day. That's below the half of the public hospitals. And I think that in the private hospitals, advantage is that you you have a better treatment, like not a better treatment, but a more specialized treatment. They have more time to know if you have this or that, to make some investigations in your body. And in the public hospitals, of course, you have a doctor that's going to try to help you, but he doesn't have as much time as in the private hospitals. In the other side, in the United States, it's completely the opposite. um, in the public hospitals, they have less patients than in the private hospitals. Why? Because in the private hospitals, they have paid, like, they pay the doctors to attend you, to diagnose you. And of course, if you have more patients, you have more money. Instead, in the public hospitals, which you don't have any payment at all, um, uh, you have more patients. No, sorry, less patients, because it doesn't matter if you check 100 or 20 people, you don't have like any pay at all, or you don't have any uh, benefit in money. Okay, you just attend, and of course the doctors got paid because it's not free, but the hospital itself doesn't have like a winning. Okay, but in a private hospital, the hospital has a winning. And I think that's a really interesting difference, that in Mexico, the ones that has less patients are the privates, and the ones that have more patients are the private in the United States. I think that's a really cool comparison. Well, that's all for me today. Thank you for listening. My name is Diego Velasquez. Good night.